this morning. We've got a double header, actually. Deirdre Savage is joining us, but so is Renee McGinnis. Renee is our current chair of the Chamber Board, and Deirdre is our incoming chair for next year. Although we do have to have a discussion about whether or not this is a year frozen in time, and Renee does 2 years.
Oh,
and,
come on, Deirdre. She's just waiting. She can't wait. She's just waiting. I never want to steal Deirdre's thunder.
It is so odd. I work so closely with the executive committee, and so much of that is at least 2 meetings a month face to face. So it is like a frozen year this year. It's a very odd feeling. But Deirdre's joining us. Deirdre has a long background in healthcare and politics. Been involved. I'll let her do the bio, but currently she is on our executive committee, chaired our government affairs committee, our incoming chair for next year, heads up federal government relations for Blue Cross Blue Shield. That's got to be an easy, puffy job, I imagine. Doing federal congressional relations, being with the largest health insurance company. But Deirdre, let me turn it over to you to give a little bit of your background and some of what you're dealing with now. And for those who aren't aware of it, Blue Cross Blue Shield has a huge South Shore presence, both in Quincy and in a large building right at the end of our street here down in Rockland. So a good neighbor. But Deirdre, let me turn it over to you.
Yeah, I'm not going to spend too much time on the bio piece. I mean, I am a lawyer litigator by training, but quickly returned to doing what I really loved, which was more in the government affairs world. It's something I had done for some amount of time before all that, and have been 15 years at Blue Cross. So pretty exclusively healthcare focused for that time. I think in my capacity as one of the executives at Blue Cross, that on a routine basis, because we are such a civic-minded company, and a lot of that falls into the government affairs space, that I do spend a lot of time thinking about whether it's the healthcare community, Massachusetts community, the South Shore. I do spend a lot of time with the company thinking about those issues. So the current crisis has really put a lot of what we've done and talked about and worked on since I've been there, really into focus. So, I would say in terms of the impacts that we're feeling, and quite frankly, the South Shore is, we've got over 3,000 employees, most of which are between 2 buildings. We've got one in Quincy at Enterprise Drive, and we have, we call it the Hingham Building, 25 Tech, which is right on a Hingham Rockland, it's like Rockland Water and Sewer, but Hingham Fire. It's just funny. So we have all those folks that are used to coming into our building. And like I said, over 3,000 of them, 98% of us are working from home. And quite frankly, the only ones that are going in as a health plan, we have a lot of things that need to be touched, as do many of you, I'm sure. People send in their payments. We have to get enrollment out to people. There are things we cannot just do remotely. So there's a lot of those folks in doing that work. And that was really, as I'm sure for all of you, that was our first priority, was our associates, and, figuring out what, 2 things, what they needed to be safe, and 2, how we could still work as a company remotely. Now, thankfully, actually, I don't say thankfully, but because of all the snowstorms, from a couple of years back, we actually had moved to being able for people to work from home at that time. So we actually were pleasantly surprised that it went pretty smoothly. It wasn't, there weren't a lot of hiccups. I had to go in and get a headset because I hadn't used headsets, things like that. But in terms of getting people up and running, we've been able to do that from a member service point of view for a long time. So now, I'm sure we'll talk about at one stage, it's how do we all get back? Do we all get back? What does that look like? But yeah, I don't know, Peter, if you want me to kind of launch into the core challenges we're facing that I think reflect what business is facing.
Yeah. Let me make sure I'm unmuted. There we go.
Yeah.
Before you get into what businesses are facing, I am kind of curious about the litigator background. Were you an ADA?
No. Although I went to Northeastern Line. I did do a co-op at the U.S. Attorney's. No, I was in a civil capacity. So, one of these defense litigation firms in downtown. So a big firm, and it was one of these places where you graduate from law school and you have 50 cases. And, I was lucky in that I had lacked, when you appear in front of judges, I had worked in Senator Kennedy's office for several years before law school. And a lot of people get intimidated when they first appear in front of judges, but I had like as a young, foolish kid, had the experience of being around senators and things like that. And I just was like, oh, this is nothing. So I was able to just kind of shed any kind of fear factor of going in front of there. Now, it wasn't without challenges, but yeah, no, that was my, I loved it, but it's hard when you know what it is you end up, it's just the cycle is. And I advise when I mentor people, I often talk about, you have to know kind of what gives you a charge, and healthcare policy in general did. And I was lucky enough to I worked at the New England Council, as you know, Peter, for a number of years. And then right as healthcare was being done in Massachusetts, I had a lot of exposure in that world. That's when I kind of got pulled into Blue Cross and was really able to kind of enjoy the fruits of the Massachusetts labor, bring that down to Washington. At this stage, Senator Kennedy was still with us. And that's where we were able to kind of help shape the ACA, and while not without flaws and all of that, it was something that was really remarkable. It is the most dynamic time to be in healthcare, so I was lucky to kind of land on it at that stage.
We've been hearing from a number of healthcare professionals during this series. Renee and some Rich Fernandez at BID Milton, folks from South Shore Health. And we hear about this odd situation where healthcare is forefront of the news, and we're hearing about the surge and burden on hospitals, but in fact they're starving because all elective procedures have been postponed. In some odd way, will healthcare costs decrease this year because so much has been put on hold?
Well, it's a real conundrum, and I'll talk about it because it is at the forefront of the news. So we're in touch with healthcare, whether it's hospitals, doctors, the entire healthcare community on a daily basis. You can imagine. We have a lot of inquiries into us. Two things are happening. We prepared for, and we're proud of, the preparation for a potential surge. At the same time, the state, and when I say we, I mean the state, the healthcare community, I don't mean just Blue Cross. At the same time, we imposed all the social distancing measures. So the surge while there was a surge in terms of hospitalizations, it we were prepared. With that being said, in doing so, and in the cancellation of elective procedures, a lot of providers are have different experiences. So they have this influx of COVID patients, and they are really significant patients. A lot of them are in the ICU, but the rest of the hospitals are without, which normally you feel like, great, people aren't sick, but the fact of the matter is people are sick, and people are deferring care. Now, for some things that's okay, because, you know, for something that that's not a chronic condition, and it doesn't mean that people aren't suffering, but, you know, a knee surgery, for example, that could be put off for 3 months, is a lot different than cancer care or diabetes care, and a lot of the chronic conditions that we are spending a lot of time reaching out to people to remind them it is okay, you need to seek care for these conditions. And that's been the latest wave of the activity. And you're right, we are a healthcare community in Massachusetts. There's nothing, you know, that's it. Straight in, you know, it is what has that, and the education community is kind of in those things that have floated us through recessions in the past, a little bit better than our other states. So it's important that the community doesn't suffer too much. Now the question is, what does it look like? We've been advocating for, and we're pleased that the federal government is stepping up in some ways. So there's a lot of provider funding coming out the door. I think we're over 1.6 billion in Massachusetts based on the latest round. And that's, you know, not all the distributions are perfect, but I think they're trying. There's another 75 billion, not just coming to Massachusetts, to be distributed over the next week or two. So there is that, and we're pleased that the federal government has kind of seen that role. In terms of, will healthcare be cheaper because people aren't doing it? That's where the challenge is, because it is deferred care for the most part, and the actuarial analysis of how much of that comes back and when is critical, because you figure out, you know, you'd expect obviously some of that care will come back. Question is how much, and what we're hoping for as an industry is that the federal government takes a look at this and says, listen, we're going to have some risk mitigation programs come into play. And those are basically like, hey, if your claims exceed a certain amount, we'll kind of backstop some of that. And that is so we don't have to get into the actuarial math of trying to extend what we think might come back if it exceeds that. It only takes place if it exceeds that, so that we can keep rates at a place that are sustainable and affordable. We're getting calls, you know, a lot of businesses have gone out of business. A lot of folks are looking to defer payments. There's a lot of things that we can see that's happening. Our hope is that whether it's through small business loans or through potentially, if COBRA was to kind of have a little bit more of a federal subsidy, that people maintain their health care. It's not just about Blue Cross and our membership. That's quite honestly, yeah, obviously we care about that. But what ends up happening is if people slip into Medicaid, providers, and I know there's some on the phone, would much rather commercial payers to be in the mix. The state has taken a heavy hit. The more on Medicaid really strains those. And we're hoping for a return to a new normal in the future. So we want that healthcare to continue. Interestingly, Peter, certainly the visits that we've talked about and providers are, you know, the offices are not being filled with patients. We have gone from 200 telehealth claims a day in February to 40,000 a day. 40,000 telehealth visits a day. Now, what we're excited about on the one hand is that people are beginning to kind of do that. I did one, South Shore. I did one not too long ago. But interestingly, I don't believe it's quite half. It's just around that number. for mental health, behavioral health. So we're really excited that that will be a sustainable future in terms of if people have challenges, that people are now seeking mental health treatment in ways that they may not have had in the past. So that's really, and clearly this has been a strain on mental health for some time. So, but I throw that out there, but it has been remarkable.
So what are companies generally going to be facing coming out of this with healthcare, and how is the healthcare industry likely to change? And fair warning, you do have some other healthcare, you have some healthcare providers joining us, and I may call on them as well to tell us
I
how
hope
they
so.
healthcare will change.
Yeah, I hope so, because I do think it's a community response. You'll see a lot, it is not just what we think. We're all struggling with that future answer. Certainly public health is going to get a resurgence and the care that it likely should. I think you will see for most folks, a lot of it will be seamless to them in some ways, but I think there's much more of there's been a lot of attention on kind of how disparities in healthcare are being accentuated now, and we're not just talking our racial or ethnic, socioeconomic disparities. So I think you'll see a focus there. In terms of one's interaction with their provider, I think I welcome the feedback of others. I think it will be like everything, like all of us, it will be a ramping up. It's not just going to be a flipping of the switch. So, the urgency of people to enter into buildings, whether, or while there be a great desire, I think there'll be some level of telehealth we expect to continue. People were not comfortable in the medium, no matter how much we talked about it or promoted it before. But I think we'll see that ramp up a little bit. Not ramp up, but I think you'll see people utilize that more. Quite frankly, I'll use my own as an example. I had, I'll tell everybody I had a kidney stone that I, decided during COVID to get one. And while I had to go in and literally get a CAT scan, and go in and get all the, gloves and all that, my appointment was with a urologist, the following Monday. And we, Zoomed or got online. The total appointment was about 6 minutes, and he didn't need to see me. He was reading my labs, and I work in Boston, and I thought about the fact that had I not done that like that, and I never have. I work at Blue Cross, we talk about telehealth, and I never did it. I always would go in, and I'm bad case scenario number one there. And I thought about the fact that that normally would have been me likely taking off the morning, planning to go in, and I don't, waiting is not something that I necessarily care about. People are busy. That's not like my thing, but I at least would have missed, a good morning of work before. And this literally was 6 minutes, and it was great. And he was lovely and all of that. And it was, but I think as people have those interactions, they'll think to the future, like, do I need to literally go in? I think really it's going to come down to, for a lot of kind of the future of this is, what is it that makes people feel safe? And there's both an actual realization of safety, and we could talk about the return to work issues related to that, and a perception of safety, and both are important. Obviously the actual is more important, but people want to feel safe, and how do we reach people in that way?
Deirdre, it's Renee. Is the telehealth, I know Blue Cross is one, actually the only provider right now that's reimbursing us for telehealth at this point in time. We're hoping Medicare jumps on board. But is the reimbursement significantly less for a telehealth visit than it is for an on-site Do you know if,
Yeah, so there is, right now, I think there's some equalization just because of the crisis we're in. And again,
right,
we're instituting a lot of policies in recognition of the public health impact. So we can't say at one time, go see your provider if we don't want them literally, in those places during the public health emergency.
right,
Um, so right now we recognize that, and a lot of our policies are like that. You can imagine there's a lot of administrative requirements, and I'm sure Renee and others on the call appreciate this. A lot of them are in there for good reason, like credentialing. We credential providers. That is a good thing for our members. We've relaxed some of that because we've got folks that we're trying to fill the provider world in different ways that likely were lacking before. So we needed an influx. So there's all these across state lines. So there's a lot of things we relax out of concern for the public health emergency.
right,
Going forward, I think as an industry, I think, everybody will kind of take a step back and think about telehealth going forward.
right,
Obviously there's, two key things. One is member convenience and member, when something's convenient. And again, this isn't just about my 6-minute issue. When something is convenient for a person, they will more likely use it. When there is a barrier that is removed, they will more likely use, which is why, again, you're seeing the government and Blue Cross and the plans remove financial barriers like co-payments around COVID-related stuff. We
right,
want you to get treated. So we don't want that to be a barrier for you. So that's why you're seeing that activity. Likewise, telehealth provides a means for people to get care. And like I said, on the mental health, that's been extraordinary because getting people to do that is a huge, just overcoming that is a big thing.
That's
And then
great.
there's the other piece, which is, providers, you then have to think about infrastructure, what is needed, what isn't. So I think it's, again, we tend not to, and I, for healthcare providers on the phone, I hope your experience is this, is we tend not to try and look just narrowly at every provider as the same exact, because they're not. They're at
Right.
different places. They serve different populations. We really reward providers on the outcomes of our patients. Not every provider is in the same place on that. So I suspect the way we look at telehealth looking into the future, again, we're still trying to figure out how to get folks back in the building, how to keep providers, in a financially sustainable place, how to make sure our members I'm not sure we're at the what are we going to do in the future
The
totally yet.
strategic
Yeah.
plan, yeah. But I think it's great, and I know you guys are always progressive, and I think it's going to be an opportunity, like you said, depends on different providers, different sectors, but for the mental health, I think it's huge to take away some of those barriers.
Yeah.
But also primary care physicians, right? There's so few, and people are, sometimes not taking new patients on. They might be able to, with
Do it
this
in a telehealth
telehealth,
capacity.
yeah,
Yeah.
do
Yeah.
more, do more and have more opportunity, which would be
Yeah, and
great.
I would say our, we talk about different populations. Seniors are not, certain age seniors are not in the same place with telehealth
Mhm.
as others. So those that are aging in right now are, and they're used to using the technology. They're used to, so, we really have to think about it in a very specific way,
Mhm.
as you would expect.
Great.
I'm going to detour this a little bit because you raised
Yep.
an interesting question about safety, perceived and real. And after this call, I'm going to be jumping on a call with other chambers and the governor's
Yep.
reopening commission. And I've been wondering, as I listen to all the advisories and people talk about
Yeah.
reopening, if the perception of safety isn't a bigger obstacle than real safety, or actual safety, because I'm hearing people thinking about doing things that they're not convinced actually makes the work environment any safer or the home environment, but it's giving people a bigger comfort level. So kind of want to throw it out to people. Kim McDonald works at a dental office. My wife manages a dental office, so I'm hearing a lot of this. What you have to do. We've got Mary Lou Sandry doing retail food. What do you have to do there to make people comfortable coming in? And there's some other people on the call. I'd be interested to hear from you. What are your clients or your own industries doing to raise comfort level, even if you aren't necessarily changing the safety equation?
Can I speak?
Go ahead. Sure. Go ahead.
So the doctor bought air purifiers. We're in a Crown Colony. We're in an office building. So every operatory is going to have a air purifier. They're going to put shields up for the front desk, and we're going to try to stagger patients. But I feel like the person in the chair, we're going to take their temperature and everything. And Peter, I don't know what your wife is doing, if that's the same thing that they're doing, but I heard that these particles stay in the air or on your clothing for 3 hours. I don't know if it's fake news or what, but they're not having the gowns. So I'm not sure, like they're having the shield, they're having all kinds of protection for themselves. But once that person stands up and it's on their clothing and they come out to me and they hand me a credit card and they touch things, I don't know. I mean, obviously I'll go wipe everything, but I don't know. If I sit next to my coworker at lunch and she didn't change her pants, I don't know. I
would think
I'm afraid to see my mother. I'm not afraid to come home. I'm not really that afraid of myself, but I don't want to kill my mother and I don't want to be that cause.
I can make a recommendation for you what we use a lot is the Epi line at the Department of Public Health, because we follow the CDC and DPH guidelines, obviously, for healthcare, but sometimes we run into these funky situations, like you just said, where, for instance, for all our home health aides who are so close, just like you at a dental office, like they are so close to the patients because they're helping them shower and, they're just in close contact.
Yeah.
So they all wear gowns. So the Epi line, these are the epidemiologists at the state, and they've been fabulous. And I can email the number to Peter so he could. And so we call them whenever we run into these situations, and they walk us through it.
And I'm sure my doctor has done that. I just don't know. Is it true? Like how much? I got something in, I don't know, the email or something, and it said the top 20 people that are subject to COVID, and a hygienist was number 1.
Yeah.
The doctor was 3, but the hygienist was number 1. And I know we're not talking OSHA here, but I just feel like I'm going back on Monday to scatter the patients out, as have them wait in the parking lot, call them when they're there, text them when their room is ready.
Yeah.
And I hope we're doing everything, but if that's staying in that room for 3 hours, what are my next 2 patients exposed to?
Yeah.
I don't know.
Yeah. That's when you run into these situations that I would just call them and get, and if your doctor may have, but.
And I'm sure he is, I'm sure, but again, it's fear.
I do think, Renee's brought up a good point of, very direct questions about particular industries. I do think it's going to be really important to kind of follow, and this is why the governor will be coming out and speaking about return to work in different segments and industries to kind of help, because there's so much information out there, and quite frankly, a lot of it misinformation, and we get the calls. So we'll get a call from your employee asking, they want me to get this done, and we're like, why would they want that? Or from our accounts as well, but that the governor, think of the state more as a source of truth versus kind of national news. There's been a lot of talk about antibody testing, and I'm not going to bore everybody of the difference between diagnostic testing and antibody testing. And with the number of questions we get on this is crazy, is that, hey, if I can prove I've had it, or my employer in fact says I need to go get an antibody test to prove I don't have it. Well, that antibody test isn't proving anything. First of all, a lot of them are not very good yet. Second of all it says is that Deirdre does have it, but Peter does not show antibodies right now. Doesn't mean that I won't have them, like you said, in an hour, and be exposing. So there's a lot. What is going to be so key to us getting back is, in addition to treatments, so that if I get sick, again, I share your concern. I'm not as worried about myself. I'm worried about my kids, but statistically speaking, they are unlikely to get it and get sick with it. It is about my parents, who I haven't seen. They live in New York for several months at this stage, that I don't want to be that to them or to somebody else's. And I think knowing that if somebody were to get sick, the treatment is really good. And then of course the vaccine. So again, all these words matters. Vaccines matter way more than anything else for everybody to be normal. That's what allows us to walk around on so many other illnesses. And it's just tough. And I think there is a lot of different information. And
But
I think
would a cleaning be considered something that you want to do next Monday?
I know.
18th?
Yeah.
No. Is that elective? That's pretty elective to me. I don't know.
Yeah. I think
Well,
you're right.
I'm ready to go to a barber regardless of the risks. And I see
I hear
Rich.
a lot of them are doing them in the
He's ready
yard.
to go get a shave at some point. So, John
Peter,
Kreitz,
what is your wife doing?
she
Same?
she manages the office. She's going through all of the advisories. She's finding that there's actually a lot of demand. She's finding from older people. Just open up. I want a cleaning, or I want whatever care they have. That's the more vulnerable population. But they're saying, to hell with it. I want my appointment. And
I agree. I check the messages every day, and yes, some of them really want to come in.
So they're coming in. She is beginning to trip over the conflicting information. So apparently OSHA came out with something that was beyond advisory about wearing N95 masks, but the State Dental Association has come out and said that actually isn't desirable. So they're getting conflicting information, which is a big concern for chambers and our members about now contradictory information coming from state officials, local officials, federal, then trade association advisories. And one of the largest issues the U.S. Chamber is getting involved with right now is liability protection.
Yeah.
Because this is new territory. People are going to make some sound judgments.
Yeah.
And there is going to be just tremendous expertise on how everything should have been done after the fact, with all the second guessing. So she's dealing with that.
Yeah.
But John Kreitz, I see your monitor at least is on the call. I'm wondering if you're still there, and if you could tell us, could you do some consulting through the Bloom Shapiro with businesses, but on HR issues? Are you what are you dealing with your members if you're there and can hear me? You might not be able to hear me.
Yeah.
Right. Let me ask John Gifford or Rich Beal, what are you doing? Because you have so many office building tenants. What are you doing in terms of perception of safety?
That we're still working on what the procedures are going to be. I mean, we're still looking for guidance, I guess, from government officials and whatnot. It's a little different for a facility like Blue Cross Blue Shield has in Hingham. It is 100% in Hingham, Deirdre, just in case you were
I
wondering.
know. I know. See, Peter said Rockland, so I didn't want to kind of call it out. So that's all right.
You do get your plumbing from Rockland, though. So
Yeah,
that's a long different story. Another government.
I know. Yeah.
But for a single tenant facility like Blue Cross or like Serono next door, it's a little bit different than a lot of our properties where they're multi-tenanted. So we've got a lobby that a lot of different tenants have access to. It's not a single employer where Blue Cross can put their own procedures in place, and that's how the buildings are accessed. So trying to figure out what a variety of tenants are going to be comfortable with, and what we're going to be comfortable with where we're not healthcare professionals. So to have an A.W. Perry employee sit in the lobby with a thermometer and try to take people's temperatures, I don't think we're going there, because that's not our business. But, we are trying to, again, put protocols in place that will help make people comfortable coming and going. But again, there's a lot of that's going to be difficult to monitor. Most of our properties, we do have security offices or concierges in the lobby where, they can help enforce policy. But, for us to tell an employee of a certain tenant that, you're out of line, you're doing this wrong, again, what are the guidelines here? I mean, we'll certainly make note and pass it on to various employers, but I don't think as far as calling people out because they didn't stay 6 feet away, or, I mean, obviously if we have mask protocols or glove protocols, we won't let people on the properties, but I think there's a pretty fine line you're going to have to walk there to implement everything.
Stefan, what are you seeing at Wells Fargo in the financial service retail world? What is your office doing for comfort level, and how are you dealing with that?
Yeah, so luckily for me, and I think unluckily for my wife, I've been working at home for maybe 2.5 months now. So, us in the commercial banking space, we're pretty good and flexible on that. So that's been a positive. I know for, some of our counterparts on the West Coast, retail is just, that the banking side of that is hard to move to digital overnight, right? I mean, I'm sure all of us and some of our clients as well, in terms of digital payments, things like that, that's hard to move overnight. And a lot of us are still having to go in and cash checks, pay certain vendors. So that's been sort of tough. But for us, because we don't have a retail presence here in New England, most of our clients are used to this digital, world that, many of us are trying to shift to. So for us, it's been good. It's just sort of navigating, the different government stimulus programs out there. I'm sure everyone's heard of it and dealing with it. So that's been sort of where our focus has been recently. But, in terms of us, and my fellow employees and coworkers, it's been a relatively simple process to move to a virtual, stay-at-home world.
Good. That makes it safer.
Yeah, definitely.
Peter, I think too, so many people are struggling with, there's so much guidance out well, not guidance, but there's so much information out there from OSHA, CDC, many Littler, all these people are putting out just huge documents, and ferreting through all of that and figuring out what you really need to do. Should you do, I don't know, Rich, any of your, in any of your buildings, you know, should you do a deep cleaning of the building and then, or the, you know, each tenant of their space, but then it's really up to the personal responsibility of everybody in the space, because you can't have someone come in and disinfect the whole building every night. So that's where it becomes, I think people have some fear around how they're going to keep the space clean ongoing. But I feel like that's going to have to be, you know, everybody's personal responsibility, and you can't congregate in the common areas.
No, we've, you know, since this has started, you know, we've been in contact with our cleaners in all the properties, and we've put in enhanced standards. You know, the cleaners have all that information. You know, they've put out increased capabilities and increased sanitizing methods. And you know, I can't comment on what all the different chemicals and whatnot they're using, but certainly we've upped the level of sanitizing of the building on a nightly basis, and sanitizing of the tenant space, and how they, you know, hit all the touch points and what they're using to make sure it's as clean as possible. So, you know, we are doing that, but I think probably some of it is, what do you do in those common areas? You know, going back to that lobby question, you know, do we have our building maintenance personnel circulating through a couple times a day, you know, wiping down elevators, wiping down doors, you know, those kind of things, so that the spaces that the common part of the buildings get touched a lot, you know, we're trying to provide a higher level of peace of mind for people who've got to access all those areas.
I do think you'll see, you know, in terms of employees, you know, we do not have an exact plan yet. You know, that's something that's being worked on, that you will see more staggering. And again, this is, you know, the challenge with this crisis is that, you know, when a vaccine is developed, there is a high level of normalcy that will return. You know, the question is how much, but when people are less, you know, when you fear less your ability to get it or spread it, or that others can be vaccinated against it. So there will be a return to some normal. It's a question of when. So some of these activities and some of these fears, hugely impactful to the economy, of course, you know, needless to say, but there is a temporary basis, you know, that we hope will return as soon as we get those kinds of things in hand. Hey, Rich or Peter, to the extent that you're down in those, around the space down in the Hingham area, I am excited that we are also, in addition to kind of the folks that, you know, the mail and all of that, we have brought back a lot of our cafeteria folks. Now they're not preparing meals for us, of course, but we're producing about 1,000 meals a day from Hingham and the Quincy building to get out to folks. You know, we're doing a lot of different things. We're working with the South Shores, the Frontline food service program that I think a lot of folks on the South Shore are involved in, but this is really to get the meals out to those in need. So we're using the cafeteria. Like, I think that's another thing, is people are trying to creatively use what's at their disposal and give people employment while doing so. You know, so you know, we're if you start seeing anything coming out down Tech Drive, that's what it is, Peter.
And I guess, could I ask you a question, Deirdre, to go back?
Yeah.
You talked about returning to work, and
Yeah.
knowing a little bit about your facility there in Hingham. I'm not
Yeah.
sure how that split is, the 3,000 employees between Quincy and Hingham. I don't think it's 50-50, but in any case,
No.
A lot of Hingham's more?
Yeah. Yeah.
Oh, wow. Okay. A lot of that space is, you know, what you call shared office space, or, you know, a lot of cubes, a lot of common areas where people interact. How do you envision when your employees come back? Are they, you know, you're going to put them in that 4-cube environment where they're all close? You know, how are you going to mitigate all
I
that?
think so. You know, we are lucky as a large employer to have a couple of things at our disposal. Like, we did a survey of our associates and their appetite and ability to continue to work from home, and how long that continues for. Of course, daycare is a huge factor for us. The average employee at Blue Cross is a woman in her 40s. And I'm not being sexist here and all of this stuff, but there's a likelihood of that age of there being caretaking situations going up or going down, like to parents or to children. So we're very conscious of that responsibility that a lot of our employees are faced with. So we don't have if we had a plan, we'd be singing it from the rooftops and promoting it to all the other employers. We're on all these work groups and all this stuff. And I know like Peter said, the governor is doing something and we're working, but I do imagine we're looking at some staggering so that not everybody's in their cubes at all time. So is it staggering in terms of time, in terms of days? I think, you are right. That's a big member service area for us. So it is more queue-based versus office-based. So in Boston, there are, it's a mixture. I'm in the Boston office, but I do think that's probably one of the things you'll look at is staggering. We are under a lot of legal requirements in terms of people being on the phones, and it won't get into it, but so to the extent that's happening wherever it's happening, I think we have flexibility given that we can have people working from home, not unlike Esfon at Wells Fargo. There is an ability to do that. Unfortunately, for many of our members and our customers, that flexibility doesn't exist. I'm looking around at a lot of people, Karen, Mary Lou, others, is that you require humans to be in your space to sell or to do the things you're doing. So it is a different standard than what's necessarily required. And the flexibility we have, whether snow is something to be thankful for at this stage, but where we kind of built up the infrastructure to be able to do that.
And just one other quick follow-up, not being a real IT guru, your whole comments on the telehealth thing, I really thought you were going to say that I sat at my house and got on with my urologist and a Star Wars laser came down from the sky and zapped the kidney stone and it was gone. So
no, the old fashioned way. We'll just leave it at that. No lithroscopy.
The iPhone technology is improving, Rich.
No, yeah.
So we're coming up on the 45 minutes, but I'm spending a lot of time looking at what the region may be needing, what our members are going to be needing, not to reopen, but for the fuller recovery for the next couple of years and how this changes dynamics. So I'm looking at how the chamber might change. If we don't make Renee repeat her year as chair, and you do come in as planned next year, what do you hope to see the chamber do? What do you hope to accomplish as chair?
I would have had a different answer 3 months ago than I have today, quite frankly. Luckily, Renee, you, Peter, the rest of the executive folks, and Renee, we're going to approach this jointly in so many ways, because fact of the matter is a lot of our, I think of them, I keep saying our customers, but a lot of, from a Blue Cross perspective, a lot of folks are going to be hurting on the South Shore, economically and otherwise. And I don't know where we're going to be as a country or as a state in January. And I want to be conscious of dealing with the needs that are in front of us. Even as a company, we have very compelling and interesting things we want to do and continue to want to do. We have to recognize where providers are right now, where our customers are right now. So I think, we'll spend a lot of time thinking about how we can best serve. I think it's going to be huge about promoting the businesses on the South Shore, and whether it's retail, whether it's restaurants, and everything else. So I really think we're probably going to want to do an analysis of who's feeling certain kinds of pain, if there's something as a trade group we can do, and certainly all the policy stuff, that's kind of second nature, Peter, for you, for I, and others that are in that world. But really, how can we be helping them? I think the chamber it's a great place for people to go for information. It's a great place for people to go to kind of collectively interact, but also for support. And I think that's going to be a role that we're going to really have to think about, and think about the future, because again, you know, I want to help all those folks, but if there is a transportation bill that passes through, I want South Shore to get the funds. Like, I want to do all those kind of things we had talked about, but I really think we're going to have to collectively think about that and plan.
Great. Well, thanks for joining us this morning. Coming up next Tuesday, Chris Odlifson will be the featured CEO next Thursday. Mary Lou Sandry, who will give us an update on the pink face masks, which she is ordering for all of her help. And then the following Tuesday, the 19th, Jim Dunphy, last year's chamber chair and president of South Shore Bank, will be on. And watch the calendar and the email notices, and then we'll be filling out the rest of May after that. Thanks a lot.
Thanks,
Thank you.
everybody. Thanks,
Bye,
Deirdre.
everybody.
everyone.
Bye.
Have a great day.
You too.